Okay, now.
Okay. My name is Darlene. I'm going to be your nurse today, and we're going to be examining your eyes, your ears, your nose, and your throat. And the first thing I'm going to have you do is I'm going to have you cover your right eye, and I want you to look at this chart and read the smallest line that you can.
Let's see. BECFD.
Okay, now cover your other eye.
Okay, I can see DEFPGTEC.
Okay. Do you wear contacts?
Yes.
Okay. You have any other problems with your eyes as far as double vision or anything in that aspect? Noticing anything changes? Okay. Well, first I want to just kind of look at your eyes, and we're going to be checking. I'm just kind of looking to make sure that they're symmetrical and they both look the same. I'm going to just look and see if you can check your retina and your sclera. Okay, I see no redness. And your conjunctivis is pink. And your sclera and your cornea looks good. Okay, what I'm going to have you do is, first of all, I'm going to let you kind of just look straight at me. And then I'm going to let you tell me when you see my hands.
I see it.
Okay.
I see it. I see it.
Okay.
I see it. I see it. I see it.
Okay, well, we're checking for your peripheral vision. Okay, now I'm going to just kind of check your eyes for the reflection of light. And make sure we got this one big enough. Okay. All right. Okay. Now what I'm going to do is kind of look at this, and what we're going to do is I'm looking for the reflection of your response in this left eye while I'm shining it in your right eye. Just check for the pupil response. And it is. Okay, that's good. Now then, I'm going to check for your red. I'm going to dim the lights. I'm going to dim the lights right behind you here. And we're going to check for the retina. And what I'm going to do is I'm looking for the red in your eye. I'm just going to follow it in. Okay, we're checking for the optic disc, the vessels, and the macula. I don't see any foreign bodies, anything. All right, we'll go to the other side. And we just follow it in. And we get just a little close to you. Okay, and we're looking at the optic disc, surrounding vessels, and the macula. Okay, and then optic disc looks fine. The back side of the redness is brownish brown and no abnormalities, and I don't see any drainage or crusting of the eyes. Let me cut the lights back on. Okay, now we're going to have you we're going to do the same. I'm going to let you look at my finger and my nose, and then we're going to check for the ocular movement of your eyes. So all I want you to do is follow my finger with your eyes. So we're going to go out and down, and we're going to go out, up, and that is the 6 cornal rows of gaze. Okay, your eyes are fine. Now we're going to let you just follow my finger in. Okay, now I want you to focus on my finger. Okay, now focus on the wall. Okay, that's good. All right, now we're going to move on to your ears. And we're first going to check the outside of your ears just to make sure that there is nothing. We're going to check the pinna of your ears, and the tragus of your ears. Any soreness or tenderness?
Mm-mm.
Okay. And we'll check your hearing. First, I want you to put your finger on this ear, and then I'm going to repeat something over here, and you just tell me what you hear.
Baseball.
Okay. Now cover the other ear, and I'm going to come on that side.
Swimming pool.
Okay. Good deal. Now, what I'm going to do here, this is called the Weber test, and I'm going to put this right on the top of your head, and I want you to tell me which ear that you hear it out of.
I don't hear nothing now. Maybe this one?
You don't hear it on both sides.
I don't hear anything.
All right, we'll try it again.
Okay, that's better. But it's like both ears.
Okay, that's good. All right, now then what I'm going to do is I'm going to put it on your mastoid, and we're going to check the boniness of your hearing, the vibration. This is called the Rena test. And you just tell me when you stop hearing it, and then I'm going to put it in front of your ear, and you tell me when you stop hearing it there, okay?
I hear it.
Just tell me when you stop hearing it.
Okay.
Okay, I'm going to do the other ear.
Okay.
Okay, that's good. All right, now we're going to look, I'm going to change this scope out. I'm going to check the auditory canal for any foreign objects or any drainage or fluid in your ear. I'm just going to push on your tragus here and pull on that. Any tenderness there?
Nope.
You know, all right. I'm just going to look in your ear here. Okay, I don't see anything. No redness. I see the tympanic membrane, and the tympanic membrane, the malleus and the cone of light. And there's no drainage. All right, we're going to this ear. We're going to pull up and back. Okay, and it looks pearly gray. Okay, no drainage, no fluid. Okay, we're going to go take this off. Alright, we're going to just press on your sinuses, on your frontal sinuses. Any pain there?
Mm-mm.
Any pain here?
No.
On your maxillary sinuses? Okay. Now we're going to move on to your nose. And I'm going to just have you place your finger on each side of your nose, and now breathe in. And either breathe in fine.
Mm-hmm.
Okay, the other side of your nose. Breathe in. Breathe out. Okay. Now, I'm just going to look into your nares and just check to see if we see any foreign objects, drainage, redness. Okay, I'm going to tilt your head back. Pull up. Okay, we're looking at the terminates and the mucosal and the septum. And I don't see any redness. It's just pink. Okay. Alright, now we're going to go and check your mouth. If you will just open your mouth, say ah. Okay, let me forward my light here. Alright, back to the back of your throat. I'm just going to use the tongue blade just so I can see your tonsils. Just say ah. And stick your tongue out for me. Ah. Alright. And there's no cavities. Okay. Your uvula and your tonsils are fine. I look like about a grade 1. Alright, I'm just going to look around in here. Teeth there, and let me put on a pair of gloves. And I'm just going to look at the palate of your mouth. Your buccal mucosa, just to make sure there's no lumps or bumps. Look there. Everything looks fine. Okay. And that will end our exam today. And we'll